I'm Jim Huffman with the Integrated Benefits Institute, and I'll be moderating today's discussion. I'm joined by my teammate, Carol Bonner, who led this research project and will share key findings. We're also very excited today to be joined by Sarah Papapa, Senior Director of Integrated Analytics at WorkPartners, and Rich Krutsch, President of Abett. Unfortunately, Tamara Lair is not able to join us for today's webinar. Welcome, Sarah and Rich, and we look forward to learning more about your role, organization, and thoughts on effective measurement strategies. We have 1 hour scheduled for today's session. We are recording and we'll share the link as well as slides to all who registered. Please take advantage of the Q&A feature and submit your questions. We block time at the end of the Q&A for Q&A, but please don't hesitate to drop a question or a comment at any time. Our topic today is effective measurement strategies for employee benefit programs. Certainly an important topic, as many employers are working to demonstrate that their programs they have implemented are having an impact. And many vendors are working to demonstrate that their programs can have a positive impact on the health and productivity of plan participants. I'm confident that you'll find today's discussion to be very informative. So let's get started. Carol, I'll turn it over to you for some highlights of the research project.
Thank you, Jim. Hello, everyone, and welcome. I'm really excited to share our research on wellness program measurement with you today. It's interesting. Organizations invest huge amounts in employee wellness programs, but many struggle to measure their true impact. So, IBI every year surveys its stakeholders, over 1,800, and actually twice this year, to understand what's really keeping them up at night. And measurement challenges come up again and again. So we dove deep into 3 very different organizations to uncover what works and what doesn't when it comes to measuring the effectiveness of the programs. And I think you'll find some valuable takeaways here that you can apply right away. So before we jump into the results, let's talk about where things stand today. IBI uncovered some pretty eye-opening gaps in how organizations are evaluating their wellness programs. Here's what we know. About 64% of organizations have an annual evaluation cycle for their wellness programs. But, and this was surprising to me, roughly 10% either have no structured evaluation at all or only assess things when there's a crisis. That's like driving with your eyes closed until you hit something. So let's look at this. There's a huge difference across industries. Healthcare organizations lead the pack with 60% tracking across multiple metrics, but tech companies, despite their technical know-how, are only tracking about 40% of key metrics. When it comes to what organizations measure, convenience wins over value every time. Employee satisfaction gets tracked by 77% of organizations because it's easy to collect. But the metrics that really demonstrate program value, health improvement, is only 57% of organizations, productivity, 50%, and absenteeism, 44%. And here's something else I found fascinating. About half of employees say that their personal life experiences determine which benefits they select and use. So we're dealing with deeply individual choices that affect program outcomes. And the question is that being measured? All of this leads us to a fundamental question. How can organizations develop measurement frameworks that both capture true program value and connect to business outcomes? And that's what we're going to answer today. So, of course, IBI turned to research, but we didn't just want to review academic literature, though we always do that. We wanted real world insights from practitioners in the trenches. So we conducted in-depth conversations with professionals who are actively measuring wellness program effectiveness every day. We used a qualitative case study approach, looking at measurement practices across 3 different organizations implementing distinct wellness solutions. We have de-identified them because we're going to talk about strengths, weaknesses, challenges, but each provides unique insights. We conducted interviews with stakeholders from each program to understand their metrics, challenges, evaluation methods, and outcomes. And so I'm going to go through each one. We had SafeMotion, and these are fictitious names. SafeMotion, this is an AI-powered ergonomic monitoring system that uses wearable sensors for field workers and desk-mounted cameras for office staff. Their focus was reducing workplace injuries and improving ergonomic practices. Diabetes Connect Pro tackled condition management through integrated health tracking. This platform integrates continuous glucose monitoring, medication tracking, and personalized coaching through mobile apps. They were specifically addressing health disparities between manufacturing and office locations. And then we had Wellness 360, which was a broader approach with multiple program bundles, everything from fitness reimbursements to health coaching and mental health support. Their aim was improving overall employee well-being across multiple dimensions, but their results were mixed. Here's our key finding, and you'll see this theme throughout today's presentation. Programs with clear metrics and strong data integration consistently achieve superior results. And let me show you what this looks like visually. When we look at SafeMotion, you see that they have quite a few strengths. And Diabetes Connect, they consistently show strength across most factors, especially in clear metrics, data integration, and user engagement. On the other hand, we have Wellness 360 that really struggled with data integration, scoring just 1, and has issues with clear metrics and privacy protection too. This visualization reinforces what we found throughout the research, that programs with integrated measurement frameworks consistently outperform those with fragmented approaches. So through this research, we identified 7 critical dimensions that separate successful wellness program measurement from unsuccessful approaches. And let me walk you through each one. Strategic alignment is the biggest one. It turned out to be crucial. Organizations that effectively connect wellness initiatives to core business objectives achieve much stronger outcomes and maintain leadership support. SafeMotion was a perfect example. They directly linked ergonomic improvements to measurable business metrics. That 20% reduction in workplace injuries that was on the prior slide, it translated directly to decreased workers' comp claims and reduced productivity losses. This makes a clear connection between employee well-being and operational efficiency. They secured ongoing executive sponsorship and resources. Diabetes Pro took a different but equally effective approach. They conducted detailed cohort analyses connecting health improvements to healthcare spending reductions. Their comprehensive data infrastructure allowed precise tracking of clinical outcomes. They demonstrated 7% decrease in healthcare costs. That quantifiable financial impact made a compelling case for continued investment. And then you contrast that with Wellness 360. They had a fragmented approach. In interviewing these analysts, the analyst for Wellness 360 was the most frustrated and overwhelmed. With this fragmented approach, it made it hard to demonstrate program value. Without unified measurement frameworks connecting wellness activities to business outcomes, they struggled to maintain executive support, even though employees gave positive feedback. So the lesson there is strategic alignment requires more than superficial connections. You need unified measurement frameworks with consistent governance protocols and clear communication strategies to show exactly how wellness initiatives advance core business priorities. And then we have data management. Our research showed that what you do before implementation directly impacts your measurement capability later. SafeMotion, before deploying any technology, they established clear data ownership, privacy protocols, and integration pathways. Their system successfully integrated 3 primary data sources. They had a dashboard specific to that point solution, HR systems, and workers' comp claims. So it gave them a multidimensional insight into program performance. Next, we have population segmentation. This recognizes the diverse needs across your workforce. SafeMotion demonstrated this brilliantly with dual technology solution using wearables for field employees and camera systems for office staff. This tailored approach achieved an impressive 85% participation rate across all segments. By the way, following up with this analyst, participation has dropped off and off and off because of privacy concerns. But at the time, they had 85% participation rate. In contrast, organizations that applied uniform strategies consistently saw lower engagement and poorer outcomes. Then we have the temporal framework, the time element. This proved equally important. Successful measurement requires establishing clear timelines that capture meaningful change. We found 3 minimum requirements, ideally more, but this is minimal. 6 months baseline period to establish pre-implementation metrics, an 18-month implementation window to allow for program adoption, and measurement approaches that account for annual cycles and seasonal variations. Programs that neglect either of these dimensions risk incomplete data collection and inaccurate assessment of program value. The last 3, we have program evaluation, which requires both real-time monitoring and structured reporting cycles. The best approaches balance quantitative metrics and qualitative insights, creating a multidimensional view of program performance. And this holistic perspective helps organizations identify both immediate successes and areas for refinement. Technology integration involves balancing sophisticated monitoring capabilities with user privacy and adoption needs. Organizations must address security concerns proactively to maintain trust and continuously to maintain that participation. And then leadership engagement, it's the final dimension, but it remains essential for sustained program success. Regular value updates maintain resource commitment, while clear connections to strategic priorities ensures continued executive support. Without this engagement, even successful programs may lose momentum and funding over time. So these 7 dimensions work together to create an ecosystem where measurement practices evolve alongside program maturity. And in wrapping this up, we've learned organizations struggle to connect wellness program outcomes to business results. Our research across these 3 cases reveals 7 critical dimensions that differentiate successful implementations. The most successful programs in our case was SafeMotion and Diabetes Connect. Demonstrate clear metrics, strong data integration capabilities, and strategic business alignment. Meanwhile, less successful programs like our Wellness 360 suffered from fragmented objectives and inconsistent measurement approaches. Even with those successes and challenges, we found a clear disconnect between the analyst and the stakeholder. So to bridge this gap, organizations have to balance analytical precision with business relevance, develop tailored communication for different stakeholders, incorporate contextual analysis that accounts for workforce demographics, and build credibility by demonstrating both quantifiable metrics and strategic value. So I encourage you to assess your current measurement approaches against these 7 dimensions, and it'll help you create more effective evaluation frameworks that capture program value while connecting directly to business income outcomes.
Great job, Carol. I know there's so much information that was in your research, and I think you did a great job of synthesizing that to get our conversation started today. I had one question that came up, and then we have one that came into the Q&A box. But in your research, and I know you did some employer guidance on this report as well,
Mm-hmm.
what was a key barrier or a pretty consistent barrier that you saw for companies not taking the steps that you've outlined?
One is implementing the measurement programs after everything is in place. So it's much more difficult. And I know adding point solutions, changing point solutions happen, but and you can adjust, but doing everything at once is it's a formula for disaster.
Yeah. Okay, we did have one question come in, and the question is, I presume the results were only for program participants. Is that correct? And it came in pretty early, so I think when you were sharing some of the results of some of the programs that you looked at.
Yes, and they did have those who participated and didn't participate. They also had pilot programs and so on and so forth. But those results are for those who participated. Mm-hmm. But the key takeaway from all of that is, how did they measure it? We're not looking at, and the research report has much more detail, and it also has an example case. But what we're looking at is how they measured it, not their individual results, because your results are going to be your results.
Right. Good point. Okay, excellent. Now let's turn to Sarah Papa from WorkPartners. Sarah, if you would share with our audience a bit more about your role and how WorkPartners fits into this environment, then I know you have a few slides to share with us.
Yeah, can you hear me?
We can
Yes.
hear you.
All right,
Unfortunately,
perfect.
I know
Sorry
your
you
camera.
can't see me,
Yeah.
but that's okay. We can stay focused on the slides. But hi, everyone. My name is Sarah Papa. I'm the Senior Director of Integrated Analytics at WorkPartners. I have about over 15 years of being an analyst myself and evaluating healthcare and productivity data hands-on. For those who aren't familiar with WorkPartners, we are a health and productivity company. We offer and administer services across absence management, like leave and disability, as well as advocacy, which even includes offering some of our own well-being and point solution offerings. But today I'm here to represent WorkPartners from the analytics perspective and our team that supports different industries and other employers out there in the market. So one thing that is important to us is evaluating our own solutions, but we work directly with employers and brokers and consultants to really take a step back and look at ways to evaluate the programs that they have put in place. I would say probably now more than ever, we're getting a lot of I've heard the term point solution fatigue. People are seeing their trends go up. And then they're getting all of these point solution vendors delivering them reports that say, we saved you millions, we saved you millions. It's maybe not reflecting in their trends. So they're getting overwhelmed with what to believe. Can I take this report as is and bring it to my leader? Or is there a way we can step back and take a look at this solution and how they work all together? And really, what is that ROI that I can report up to my leadership for if this program is effective? So this slide here kind of organizes what our approach is into 3 different pillars. We say with these different programs, you want to better identify, better engage, and better impact. So starting under identify, this one's really important. And I think a lot of times gets overlooked as part of the process, but you likely have a lot of different solutions that you're offering. And knowing upfront, what is that overlap of the program criteria? Do I just want to take what the vendor is telling me the criteria is and go with it? Or do you want to build a stratification to really try and steer members into what will be the most meaningful, impactful intervention for them? So maybe one individual might fit the profile of all, 3 or 4 solutions that you have out there, but how do you really steer them to get to that one that you think will have the biggest impact? And I'll talk through that in a little bit more detail. And then looking holistically at the members. So a lot of the solutions out there are built around, medical and pharmacy data. But, even going back to Carol's research, that data integration and really looking holistically at individuals and having your data organized holistically to understand that full person that you want to engage is important. And then, better engage. That leads to how do you engage these members? So, getting members into programs has continued to be, a pain point for members that are implementing solutions. They might be offered different ways. And how can you take advantage, though, of all the existing touch points that you have with members to educate them on what your program offerings are? So some examples of this, maybe you have an on-site clinic for your employer group. Well, when an employee comes in, do the clinicians there know about all of your other programs offerings? Can they use that existing touch point to educate members? Another example is members that are filing for short-term disability. They are calling in. We know they're going to be on the phone with someone to talk about going out on that disability. How can you take advantage of that touch point you have with the member as means for another opportunity to engage them or steer them into your program offerings? And especially as they're coming in seeking help at those times, that's really grabbing those right people and at the right time, because they're going to be more willing to take and accept that help when they're going through an event like that. Then better impact. So I have on here harnessing the power of all of the data assets available. So if you're the owner, somebody that's implementing one of these point solutions, maybe you oversee your group health, your medical, and your pharmacy data. But your organization likely has a lot of data assets available to you through your safety department, through your managing your leave team, understanding just those HRIS variables, those human capital variables, the work variables, that help understand the social determinants of health. So are you thinking across the full organization for how to really take advantage of having all of that data and putting together a broader set of outcomes using that data? So I know one of the services we do offer at WorkPartners is data warehousing, but maybe you already have a data warehouse. It's probably good to stop and reflect what all information is going into that data warehouse. Am I optimizing it? Am I incorporating the broadest set of outcomes that I could have on these individuals, and maybe expanding upon that? The other bullet I have on here is focusing on well-defined outcomes. So another challenge I would say that we've seen in that employer space when doing an evaluation is a client might see a report and it's not necessarily showing the savings they would expect. So then it becomes kind of explaining other outcomes like, well, I've talked to people and I know they're happier. People like the program. They're happier at work. They're doing better at work. They're coming to work more often, which is great. And those are positive outcomes. But if it wasn't a well-defined outcome that you thought of at that beginning of the process, you might not be capturing that. That's going to be harder for you to track and show. If you don't have an employer survey showing that increase in member satisfaction for their job, for their benefits, because they have that program service offered. So again, kind of going way back to that beginning step and understanding what outcomes do you want or would you expect or would be ideal to have, and establishing, a means to collect them, getting them into your data warehouse or planning to have a approach for getting those metrics incorporated into your evaluation. We don't want them to be an afterthought. Those are all things happening. And thanks. Click one more time, Carol, if that's okay. So I wanted to kind of bring to life a bit more an example of saying integrate your data, look at more data, have this holistic approach, because a lot of times those sound like kind of buzzwords, but putting an example together really helps to understand how you can use that data and how it might paint a different picture. So the first column here is looking at group health data. So you can see this member has about $21,000 in total cost. We can see that they just had a knee replacement surgery. So maybe if you had a MSK program, this member is hitting as an ideal candidate for the MSK program. We can see that they're diabetic, but they are compliant with all of the clinical guidelines. And then HUE is our risk score. So you can just think of that as a risk score that you have. But we can see that their risk score is about 5, 1 being average. So they are riskier compared to the normal individual in the population. So with this criteria, maybe they do get triggered to be sent off to both of those 2 different point solutions. But as we start to layer in a bit more data, we can see they had an additional, $33,000-ish in cost to get us to that total of 52,000 in integrated cost. We can see they were out on both short-term disability in the past 12 months and on had a workers' compensation claim. And those total lost work days ended up being about 15 weeks of work. They missed about 76 work days in the year. This employer did have survey data, so we can also see that they are self-reporting that they are stressed at home and they are stressed at work. So they have a lot of other factors outside of what you can see from their claims data. And if we have an integrated risk score, you can see how now they are starting to look a little bit more risky. And then finally, if you start to incorporate some of those HRIS variables, performance variables, shift data, you get an even better picture of what this member looks like. So this is somebody who has been at the company for a long tenure, about 23 years. They are a low wage earner. So they are making pretty low wages, close to minimum wage. Here they're about $19 an hour. And they have a pretty demanding physical job. So they're a technician. They have different shifts that they work. And if we look at their performance evaluation, they are below average in their work performance. So with that holistic approach, maybe just kind of sending this particular individual off to a musculoskeletal app might not be the best approach for them. This person probably needs a bit more of a holistic counseling. Maybe that's, better understanding, getting with a financial counselor, talking about their health, talking about how to manage their home stress, their job stress, having to deal with missing 15 weeks of work. That's a big life event. Outside of just having the surgery that they likely need help with navigating. And it does kind of go back to Carol's research too of the different population segmentation. So having kind of segmented different approaches for different individuals. So this individual probably would benefit from that phone conversation of understanding what is available to them. And we can see they had two existing touch points with the organization. They would have talked to someone when they filed for a short-term disability. They would have talked to someone while they were out on their workers' compensation claim. So using that to kind of integrate in educating on the programs available and getting them to the right person, at the right time during either of these events. It is kind of what the WorkPartners approach is when we're looking at point solutions and making recommendations on how you can optimize them. And then one last slide, and I promise I don't want anyone to get too overwhelmed. There's a lot of information on here, but I wanted to just use it as an illustration of means for how to evaluate these different programs. So kind of going across the top here, I have, monitoring that integrated cost. So with any program or point solution, it is important to understand what is that total cost of the person. If I look all in, how are they trending? What is different about those that chose to, engage in the program versus maybe a comparison group of those that didn't choose to enroll in a particular program? And in this example, we did risk adjust that enrolled group as well as the non-enrolled group, so that the defense wouldn't be, well, these members are more risky or behave differently. The other piece of this is kind of going into the middle section. This says integrated musculoskeletal costs, but really I have this in here to represent what are the program defined metrics, those quantitative metrics that the program claimed that they were doing. So in this case, it's a subset of musculoskeletal costs. The program said, we can impact this subset of costs. And maybe these defined metrics could be, increasing adherence, improving HEDIS guidelines, reducing A1C levels. Depending on the program, there's going to be a lot of variances in the claims that the program makes and what they specialize in and what they do. But it is important to capture those metrics that they're really focused on, that they're claiming that you'll see the biggest impact on. And then the last graph here, or the last kind of column with lost work days, this is where all of those other, additional factors from being in the program of, they're at work more, they're reporting better job satisfaction, maybe they're improving in their performance at work. This is that kind of representing that section of metrics that you can monitor of who is in the program, and how did those productivity type metrics compare to those that chose not to enroll. The other point I wanted to make on here is when you're looking at integrated data, and again, this is an MSK example, but if you're not including workers' compensation, especially for a program of this type, you might be missing about 10 to 25% of your total MSK cost that this program is targeting. So if you're looking for that number, you're looking to find that ROI, you want to make sure you're including all of these different data sets that are going to be contributing, that are going to be helping you, champion for this program and what it's doing. And the best way to do that is, what we think is really looking at all of your data and putting it together. So the last thing I wanted to comment on, and I don't have a different slide for this, but part of the research and part of the discussion is around how often should you be looking at these metrics, and when, and what is the time frame of setting up reporting. So back on my first slide, I talked about better identifying members, that having criteria to identify members and understanding who is going into the programs is something you should be setting up and looking at right away. Because if you're 1, 2, 3 months into this program and you're not seeing that engagement that you want, or you're seeing that those that are engaging are not your target population, maybe they don't have lost work days to reduce. Maybe they don't have the MSK costs that you're targeting to reduce, but having those kind of as soon as you can get those set up is one thing that we recommend looking at and monitoring, so that you don't get 6 months, a year down the program and aren't seeing the results that you want. So that'll allow you to react, to understand, are you getting the right people, as well as are they engaging in the program. And then with evaluations, a lot of clients do set up dashboards to constantly see what the metrics look like, what the trends are following the group of individuals that are enrolled. But we do typically recommend kind of every 6 months to in a year. So I guess still every 6 months, really taking a look at the individuals in the program and drilling more into this broader set of metrics to understand how the program is performing, and if you do need to take a timeout or change the tactics or who you are targeting for that group.
Sarah, that was fantastic. I really like the identify, engage, and impact slide, and then your second slide with the kind of the layering in and building the profile. That's really a great view. I had one question, and then we had a question come in the Q&A, but when you think about the eligible group, what about dependents? So employees, you obviously, an employer has more data on the employee. They've got performance, they've got lost work days, but for those programs that are available to the family members covered under the plan, how does that change the measurement and how you look at the program, the effectiveness of a program?
Yeah. So for employees, you will likely have a broader set of outcomes. And what we typically do when we're evaluating that spouse or dependent population is really just narrow in on what data we do have available to them. So that might be looking at, the subset that falls into the medical and drug, but we can still monitor, what does their risk look like? Is their risk going up or down? And we use a lot of the spouse and dependent information. Maybe you just are offering a program to an employee, but being able to see, an employee has a dependent in the NICU or a spouse with a substance abuse problem, but you can also use the dependent and spouse information to help identify employees who are in need if you did want to target programs more specifically to employees, through EAP or other types of program evaluations. But in terms of what would we evaluate if it is dependents and spouse, we really take as much data as we do have. And we may look to see if the employee has improved their lost work days, just, unscheduled time off as a result of a spouse or dependent being in there. But typically we do just have med farm and a risk score.
Okay. Let me get to the question that came in from our audience today. How do you control for selection bias when comparing outcomes for people who enroll in a program versus those who don't, given that people who enroll might be more motivated and more likely to comply with the program?
Mm-hmm. That's a great question, and that is a challenge that we face. So we typically look at what the volume is in the same employee population to find kind of a matched criteria. If we're seeing that the program really is attracting a lot of individuals in the program, so maybe we're not left with a very good control group, we would tap into what we call our research reference database to identify clients that don't offer these types of programs that would have a similar profile. So again, we would be looking for similar job types, similar salaries, similar demographics that we could group on. If we don't feel like the representation of that group from the non-participants is there. Although we do try to start with them, but the matching criteria would be a bit stricter so that we are making sure we're getting a comparable group of like-minded individuals and not just those that aren't likely to join a program in general.
Okay, very good. All right, excellent. Thank you, Sarah. Appreciate all that perspective. Next, let's turn to Rich and bring him into the conversation. Rich, thanks for being here today, and I would love for you to just share a little bit more about Abett and how you're helping companies with their measurement strategy and this really fascinating topic of kind of evaluating programs to make sure that they're making an impact.
Yeah, thanks, Jim. Really appreciate the opportunity to be here. And as always, appreciate the research that IBI puts out from my days back on the board here. I have always found it to be very valuable and relevant to what's going on out there. So Carol, thank you and your team for putting it together. There were three things, or actually four things that stood out in the research that I'll kind of call out as I go through a little bit more about Abett. And I think I know quite a few of you out there from past experience, but for those that don't know me, I have a kind of a similar background to Jim. Jim's done a lot bigger and more, but I led benefits for a large U.S. employer. The thing that was unique about that is we also served as our own TPA. So I led a TPA service and really gained respect and value for data. While I was doing that, built some of my own analytics engines because I got frustrated with what I was able to get my hands on in the market. And then moved over and I led strategy for a consulting group for a couple of years, and led me still this kind of journey to utilize data to drive better results for members and plans to Abett, where we cover about 3 million lives out there and some of the more innovative companies in the U.S. But I was thinking last night about what I was going to talk to you all about, and I'll get to more about Abett here in just a minute. But I kind of measure my life now in pre-COVID and post-COVID Maybe some of you all do that as well. But I was delivering a keynote to the conference boards in New York about 2 years before the pandemic. And the topic of the discussion was, are we building a more fragmented environment virtually than what currently exists in brick and mortar? And there was a lot of debate around this topic. But I think as we've seen develop over the years through the pandemic and where we are today, is that we've done exactly that. We've created this kind of fragmented, we talk about holistic health and well-being and a unified approach to outcome improvement, but then we go back and attack it from all these data silos and this proliferation of point solutions. And I'd like to push back just a little bit on this idea of point solution fatigue. I don't think it's the point solution fatigue we're dealing with. I think it's value fatigue that is really at the core of what we're up against. And it's because we have let people define value in a lot of different ways. And but the value is really up to the definition of the client and what they want to achieve with that point solution. And that is really what we're after, and what I'm going to talk a little bit about how we attack that here at Abett. So if you want to flip over to the next slide, Carol, or whoever's running the deck here, going beyond, and go one more here. Okay, everyone has a strategy, but the issue with the strategy is, how do you execute? Execution is the issue here. And back to that alignment, it's alignment of how you want your strategy to work for your population. And I agree with what Sarah said. Every data point is relevant to determine what's really going on in the population, the hours worked, the leave data. We are really data agnostic. We have our own universal person ID, so we can bring in any type of data that a client feels is relevant, and our health economics and outcomes research team believes is relevant to help make better decisions within that client's ecosystem. So we've got 3 core components of our offering. The first is the Abett connector. And won't we advance the slide just a little bit here? Go ahead and go through this one here. So the Abett connector, and what is different between us and some of the other maybe data warehousing solutions out there, is we're built as a high velocity data exchange. We believe that data should be put in motion. Now, we can look like a data warehouse while the data is static in that environment. We can do all the analytics, population health analytics that are necessary to give insight as to what the risk factors are within that population. But the real value is in this near real time, be able to bring in data from your carrier to your point solutions, HRS data, any other data sets that are relevant, and be able to surface those to the point solution so that you can really drive the value proposition again back to the definition of value within that particular client for how they would like their ecosystem to perform. So the Abett connector is this exchange mechanism. We are at our core a software engineering company designed to be able to handle huge amounts of data, normalize them in a canonical dimensionalized table, and then extract that data and send it to the right point so that they can be of best service to the members of your population. One other thing that I wrote down that Carol said is that plan performance is based on individual choice. There are aggregate risk factors at play within a population, but how the plan performs is really individualized. It's based on what happens with that individual over time, how that ladders up to the overall plan performance. So to activate that, we've got our next component of the Abett solution is our Abett analyzer. That drives insights not only at the population health level, but down to the individual care gap, care defect, and individual risk factors that impact the risk level and outcomes that are likely to happen with that individual. When you have near real-time data, you're able to understand what happened yesterday, what is going on right now today, and what is likely to happen tomorrow in your population. That allows you a great opportunity to drive value by connecting your ecosystem in a way that drives value across the ecosystem by tying in the partners that are relevant to that individual and their care path journey. Okay, let's go one more slide here. That brings us to activated data. We've seen this across the board in a lot of consumer-facing solutions out there. You know, Netflix knows what you like to watch. Starbucks, if you walk by Starbucks, they're going to offer to make a coffee for you. Things like that happen. We haven't taken that approach in healthcare, and I think it's time that we do. The Abett activator is really a benefits optimization engine that drives intelligent workflows to help people understand what the correct care pathway with the solutions that are available within an employer's ecosystem, so that they can get to the best result as possible, as quickly as possible. Those individual, I totally agree with the individual choice. The problem with individual choice is that most people don't have the relevant information they need to make that choice at the time they get to a decision node. So by creating these workflows, we're able to tie in the resources of an employer's ecosystem to drive improved outcomes and improved results across the entire ecosystem landscape. An analogy I use a lot of times when I'm talking to potential clients for Abett is air traffic control. If you think about Abett as air traffic control, we're able to monitor almost near real-time basis the altitude, the direction, and the velocity of everyone in that ecosystem, watching for real-time alerts to where one of these workflows should be activated for that individual. Once we get that alert, we're able to bring that workflow to life for the individual to tie in the resources, whether it be a caregiver solution, it could be a diabetic management solution, could be direct care through the network that the employer has. The value of that is being able to course correct and drive more optimal care pathway decisions across the ecosystem to tie in integrate the solutions that client brings to bear to drive the best results possible, while taking the burden off of overstressed benefits teams at the same time. We give them insight. Not only are population health metrics valuable, but the insight as to how their ecosystem is addressing those population health risks is critical. Are the solutions that they brought to bear on particular risk factors in their environment actually doing the job that they purchased them for? And if not, what can they do to help that point solution do a better job, or do they need to find a replacement for it? With that all in mind, let's go one more slide here. Again, to kind of go over this, the real-time data exchange is the core, the foundation of what we do. All your data in one place, the 360-degree view of the member, and the intelligent workflows are really what drive the improvement. We see every time that we have piloted one of our workflow opportunities, we have exceeded the value of our contract with that particular client. So I think alignment should not only be within the ecosystem, but with also the data partner you're working with. We should be aligned to the interest of our clients. So we put, for the full Abett platform, we put our fees at risk, and the sole discretionary authority of whether or not we've saved money for the client is with the client. So we want alignment to be not only within that ecosystem environment, but with us and how we support our client base. So those activated insights and real-time interventions and course corrections are how we drive value. We got a lot of examples of that. I didn't put them all in the slide deck here, but we've done things as broad as steerage on generic drug capabilities. It could millions of dollars. I think the actual figure is 17 million. It could be something as simple as helping first-time moms that have an ER visit understand how to avoid that second ER visit. Again, utilizing the resources that are available within that client's ecosystem. So it's really across the board as to the complexity of some of these intelligent workflows, but they're designed to understand what's going on in that client's ecosystem and with that member, and help drive better results and better outcomes.
Hey, Rich, I'm fascinated with what you're building here. When you say real-time data exchange, real-time, I mean, what does that real-time mean?
Yeah. Well, the only limitation we got, Jim, is the ability for the data source, let's say a carrier, to give us data. So most of the large carriers, we get data feeds either daily or weekly. We'd love to get it real time. We're starting to get prepaid claims now from some of the carriers. So it's real close. It's not the weeks, months, and once we get that data, it's hours before it's available to our clients for usage in the data activator, the Abett activator, these workflow systems out there.
I think that's so impressive. Prescription drug data is daily, right? That stuff is adjudicating so fast, and it's so important when you think about people who don't fill or refill a prescription drug. And, when the PBM or the administrator comes in quarterly or hopefully not just an annual report to tell you what has happened in the review mirror, there's not much a sponsor can do with that. But if you're getting that near-time, real-time data, then you can act, right? Then you're informed, you know where to start focusing your attention. I think it's fantastic. So congratulations on that. I have one other question, which I know you'll appreciate given your experience on the employer side, but I liked your definition of value or kind of nuance of value really being in the eye of the sponsor or the program. How important is it to bring in business leaders? So, the benefits person, yes, HR, total rewards, yes, but talk a little bit about the business unit leader where this really makes a difference.
Well, I think, they're all stakeholders in this, right? So, the operations component of a client, they're dependent on having a healthy and productive workforce. The CFO is really interested in making sure that they're getting value for the money they're spending. So I think all the stakeholders are important in creating that definition of value and strategy so that the whole ecosystem can be aligned and everyone at the client can be aligned on what we're trying to drive, how we're driving it, and what are those results.
Fantastic. Okay, I know we're right at the top of the hour. We probably could have gone on for another hour with this conversation. Carol, thank you for the summary of the research report. It's available now on our ibiweb.org. If you haven't seen the report, please take a look at that. Sarah and Rich, thank you very much for your contributions, perspective, and what you're doing to help the industry, both the employers and the suppliers that they work with, to measure this stuff and really look at how it's making an impact and where to spend their dollar and make their investments. Thank you to everyone who's joined us today. As a reminder, we will be distributing a recording of the session as well as the slides that were presented today. Have a good day.